The annual election period goes from October 15th through December 7th for Medicare beneficiaries, and it's the time where Medicare Advantage and individual standalone Part D prescription drug plans come out with changes on their particular plans in terms of their benefits and premiums and overall viability for your needs and preferences for the next coming year, taking effect January 1st. Now, you have from that time period, October 15th through December 7th, to make changes to your plan if you do not believe it's a good fit for you any longer. And all these changes go public October 1st. So one thing that is very common and is a certainty during this time of the year, during the annual election period, is you're going to be flooded from people that say there's lots of changes coming. And while that is 100% true, a lot of times they blow certain areas of it maybe a little bit out of proportion to try to kind of suck you in, if you will, right? They call it marketing. And today we're going to be going through the Medicare NU 2025 version handbook that is mailed out to every single Medicare beneficiary each and every year. By now, at the time of watching this video, I believe that you should already have your copy if it didn't get lost in the mail. So if you actually have this book, you can actually use it and reference it on your own and kind of, go over just some certain elements of it. You can also find a free PDF to it online, and we're actually going to link that in the description of this video. So without further ado, let's go into the Medicare NU 2025 handbook, because it will tell us the truth of everything you need to know about Medicare and what's changing in Medicare for 2025. So if you're not familiar with what this booklet actually looks like, here it is. It's our red, white, and blue Medicare NU handbook that we've come accustomed to seeing from Medicare. It's an official U.S. government Medicare handbook, okay? And it's important to kind of go over it, and, I like that they've added this section of it in the beginning in terms of what's new and what's important. So the first thing they mentioned, and something that we've been talking about on this channel for months now, kind of in preparation of this, but is the mandatory $2,000 maximum out-of-pocket cap that's being placed on all Medicare prescription drug coverage, whether it be standalone prescription drug plans or Medicare Advantage plans with drug coverage. So let's kind of read through this together, right? Lowering your prescription drug costs. Because of President Biden's new prescription drug law in 2025, your yearly out-of-pocket drug costs will be capped at $2,000. If you have Medicare drug coverage Part D, and your drug costs are high enough to reach this cap, you don't have to pay a co-payment or co-insurance for Part D prescription drugs for the rest of the calendar year. Starting in 2025, you'll also have the option of spreading your drug costs across many monthly payments throughout the year. Go to page 83 for that. So what they're talking about with there is the new prescription drug payment system, where if you're going to reach that $2,000 cap, you can essentially sign up for a payment program where you pay it back over the course of the year instead of having to come up with that $2,000 all up front, if that's a financial burden for you, okay? Now, one thing that they kind of don't mention here that I think is relatively important is it's true that if you're over $2,000 normally in prescription drug costs, that it probably will save you money. But outside of that, the domino effect, because if you look at studies, most studies, depending on your source, claim that a majority, so more people than not, on Medicare spend less than $2,000 a year in out-of-pocket costs for their prescriptions than over. So if you were under that $2,000 to start with, what does that mean for you? Well, a lot of plans are adding higher deductibles, higher co-insurances for higher cost prescriptions, and that's causing prescription costs to rise. So what I'm telling everybody, and kind of what I think you can expect, is if you're under that $2,000 MAC cap in the past, you'll probably get closer to it than you ever did before. So your costs will go up. And for the minority of people that are spending $2,000 a year over that previously, you will save money. So it'll help those people, but it will cost everybody else more. So the book doesn't really kind of go into that too much, because the book is really designed to, kind of paint a picture for you that any change that the government is making is one that's going to help you. That's going to be a positive one. And, for the majority of people, probably not with this one in particular. Some people will be benefited, but not everybody. Managing your mental health and well-being in terms of what's new and what's important. Medicare covers expanded mental health care, like intensive outpatient program services in certain locations, and services from marriage and family therapists to mental health counselors, page 46. During your yearly wellness visit, Your healthcare provider can also use a health risk assessment to better understand your social needs and refer you to the appropriate services and support. So it's a little bit of an addition to what Medicare covers in the mental health side. I think that's great. They're adding this kind of thing to the wellness visit. If you're not familiar with what the Medicare annual wellness visit is, the Medicare annual wellness visit is essentially, because Medicare on its own doesn't cover a physical. They cover a physical in your first 12 months. They call that your Welcome to Medicare physical. After that, they'll never pay for one again because they don't deem it to be medically necessary. They will pay for what's known as a wellness visit, which is a less detailed physical that doesn't check blood, doesn't check urine, anything like that. And so they're adding this as an additional thing that they check for your wellness visit, which is good because those things need more details in terms of what they're actually checking. More resources for caregivers. Medicare covers additional caregiver support like training that helps your caregiver better care for you. That's good. Postal Service Health Benefits Program. Starting January 1st, 2025, for any of you postal workers out there, retired postal workers, U.S. Postal Service employees, retirees, and their families will get coverage through a new benefits program instead of through the Federal Employee Health Benefits Program. Go to page 89 on that, which we will. Change to telehealth coverage. You can get telehealth services at any location in the U.S., including your home, through December 31st, 2024. After this period, you must be in an office or medical facility located in a rural area for most telehealth services. However, you can still get certain telehealth services like for mental health and behavioral health in your home, no matter where you live. Go to page 51. So a little bit of things right there like highlighted, right, in terms of actual changes. There's a couple of things I wanted to kind of mention that I feel is important in terms of timelines that this book kind of does a good job of laying out. So let's go over to that. So if you've never read this book, if you really wanted to understand Medicare, it goes into a lot of details on, PPOs versus HMOs, what's an Advantage plan and what's not an Advantage plan, what's a Medicare supplement, what's a standalone prescription drug plan. It goes into a lot of details and all that stuff. I always joke with people and I say, if you have trouble sleeping at night, this book will do the trick. Just do some little light reading before you go to sleep at night and you'll be out like no tomorrow, okay? But this book does a great job in kind of helping you understand key dates that has to do with the Medicare annual election period that you need to be aware of. So first off, October 1st, 2024. As I mentioned, this is when all benefits for 2025 go public. So a lot of those benefits and a lot of that information, myself as an insurance broker and an agency owner have access to that information prior to that with most of this information. Not all of it, but most of it. We're just not allowed to talk about it. We're not allowed to share it until October 1st. We can get in big trouble if we talk about those things. Now, doesn't mean all brokers and agents actually follow those rules, right? So I hear it every year that, someone will call our office in September or something and be like, oh, so-and-so told me about this. It's like, well, it's actually against the law for them to tell you about that. We're just trying to be compliant and protect our licenses. But so October 1st, right? This is when you can start comparing your current plan with other plans. All information goes public. You can check new prescription drug coverages. You can check new networks for Medicare Advantage plans and which providers are in networks. But you cannot make any changes to your plan quite yet. Then come October 15th, and this goes through December 7th. This is when you can actually make changes. You can enroll into a new plan if you feel like there is one that best suits your needs, okay? And that plan, if you enroll into a new plan for next year, you enroll into it now, anywhere between October 15th through December 7th, not now, but during this time frame. And then it kicks in and takes effect January 1st of 2025. Now, your new coverage begins if you've made a change, January 1st, 2025. If you kept your existing coverage and your plan's cost or benefits change, those changes also start on this date. Then January 1st to March 31st, there's another enrollment period that most people don't know about. Medicare has actually made it illegal for anyone to actually advertise this, so that's why most people don't know about it. The advertising usually takes place in the fall, but there is another enrollment period for Medicare Advantage plans called open enrollment period. There's another time you can change. Essentially what this means is if you have a Medicare Advantage plan already, you can change to another Medicare Advantage plan, or you can change to original Medicare, standalone Medicare with an individual prescription drug plan, and that goes from January 1st through March 31st. You are allowed one opportunity to make a change. Once you've used it up, and you can't do it again due to this open enrollment period. So these are important dates to understand and kind of understand how, the whole kind of process works if you do end up deciding to make a change. This is an important change going into 2025. For those of you that are in higher income brackets, they call that IRMAA, income-related monthly adjustment. And essentially what this means is if you make too much money, they believe you should pay more for your Medicare Part B premium and your Medicare Part D. Okay. Now, on this front, this is interesting to know because these are the income limits that will charge you more. So this is how it works. The standard Medicare Part B premium in 2024 is $174.70 a month. Most people pay the standard Medicare Part B premium. Now, the 2025 numbers have not been released as of yet. Okay. 2024, if your modified adjusted gross income is above a certain amount, in 2024, it's $103,000 if you file your taxes individually, or $206,000 if you're married and filed jointly. You pay more for your Medicare Part B premium, and there's a whole chart about what those numbers actually are. Okay. Now, those numbers have not been released yet. Now, they always look at your income 2 years before as well. So to determine if you'll pay the IRMAA, Medicare uses the modified adjusted gross income reported on your IRS tax return from 2 years ago. So these numbers will be out probably in October based on the last couple of years. As soon as it's public information, we will be releasing it to you in a separate video. Now, we're kind of jumping around here, but this is a long book, right? It's 128 pages, so we're not going to be able to cover everything, but I wanted to really center in on what you can expect in 2025. Now, Medigap plans, also known as Medicare supplement plans, many of you know them as the lettered plans, right? They're named after letters, so you have plans like Plan F, Plan G, Plan N, Plan K, Plan L. As you can see, there are no new Medigap or Medicare supplement plans available. We still have the same ones available. Now, there was an act that was passed that took effect in 2020 that stated Medigap or Medicare Supplement Plan F and C were grandfathered away for newly eligible Medicare beneficiaries. So if you were eligible for Medicare before January 1 of 2020, you still have the option of picking up these plans if you so choose to. If you are eligible for Medicare after 2020, then you do not have the option of picking up Plan F or C. Most people end up going with Plan G and N, but you can kind of get an idea, right? This is every single category that Medicare covers on the medical side as a primary insurance. So the supplement or the Medigap is a secondary insurance that comes through and pays what Medicare leaves behind. And you have everything that Medicare covers built into these different categories on the Medicare Part A and the Medicare Part B side, okay? The G plan is so popular because it pays for everything outside of foreign travel. None of the plans pay 100% of foreign travel, with a lifetime maximum limit of what it'll pay out on foreign travel, by the way. But the Medicare Part B deductible, which in 2024, it hasn't been announced at the time of making this video, was $240. The Plan G doesn't cover that, but it covers 100% of everything else that Medicare leaves behind on the medical side. So that's why it's so popular. It's simple, right? The Plan F was so popular because it paid 100% of everything except for, excluding foreign travel that Medicare left behind. The G is the closest thing to that. The Plan N is a great option as well. Just it charges you the Medicare Part B deductible. It makes you pay the Medicare Part B excess charges. And it also, in this category, what these three little stars mean is it charges you a few copays for certain things. Like it charges you an up to $20 doctor copay. It could be less depending on the doctor. And then it charges you a $50 emergency room copay as well. So a little bit more out-of-pocket responsibility, but in some areas, the price difference on these two plans is vast, and the N makes more sense, right? But I wanted to show you this so you can see there are no new Medigap or Medicare supplement plans available in 2025. Now, I wanted to go into a little bit more detail on the new prescription drug plan changes. As you saw at the beginning of the book, those are the only new things that Medicare has this year. So regardless of what anybody tries to tell you, this is straight from the horse's mouth. This book is put out for Medicare, and there are no additional changes other than those on the Medicare front of things, okay? But this Medicare prescription drug plan change, right? Out-of-pocket limit and drug costs. So this says in 2025, your yearly out-of-pocket drug costs will be capped at $2,000. Once you reach that limit, you'll be 100% covered, essentially is what it's saying. And then you have the Medicare prescription payment program. So starting in 2025, this new payment option works with your current drug coverage to help you manage your out-of-pocket drug costs by spreading them across the calendar year, January through December. This payment option might help you manage your expenses, but it doesn't save you money or lower your drug costs. If you select this payment option, each month you'll continue to pay your plan premium if you have one, and you'll get a bill from your health or drug plan to pay off your prescription drugs instead of paying the pharmacy. All plans offer this payment plan, and participation is voluntary. So what this means is if you want to utilize this, it's something you have to opt into, but it doesn't save you any money, but it also doesn't cost you any more money either. They don't charge you interest or anything like that. So this essentially helps you stretch out these large costs up to the $2,000 max out-of-pocket cap in 2025. That's a brand new thing, never was available before. Now, diving a little bit into the Federal Employee Health Benefits Program, also known as FEHB. So what this was is it's essentially a group plan or a retiree plan that federal employees got access to. It's changing quite a bit in 2025. So starting January 1st, 2025, eligible U.S. Postal Service employees, retirees, and their families will get coverage through the Postal Service Health Benefits Program, PSHB, instead of FEHB. Okay, and then it gives us this link we can click on to learn more. So we'll quickly kind of do that, okay? Going into this, essentially, the Postal Service Health Benefits Program is a new separate program within the FEHB program administered by the Office of Personnel Management, OPM, okay? Becomes effective January 1st. Let's see, what are the facts on this? Former Postal Service employees and their families, members who are on temporary continuation of coverage prior to January 1st, 2025 through their FEHB plan will continue with the FEHB plan after January 1st. So that's interesting information. If a Postal Service employee or Postal Service annuitant is covered under a family member's FEHB plan, not through the Postal Service, they can continue that coverage after January 1st. Postal Service employees and Postal Service annuitants will no longer be eligible to enroll or continue enrollment in an FEHB plan as of January 1st and must enroll in a PSHB plan to maintain health coverage through the Postal Service. So this is interesting, right? So what does it look like? As part of the FEHB program, PSHB plans will cover the same set of comprehensive health benefits included in the FEHB plan. So it'll cover the same basic principles from what it sounds like. PSHB plans will be offered by many of the same carriers that offer FEHB. There are few important differences. So the PSHB plan year will run from January 1st through December 31st each year. This is the same for the annuitants covered by FEHB, but different from the FEHB plan year of the employees, which begins on the first day of the full pay period of January each year. As required by the Postal Service Reform Act of 2022, certain Medicare-eligible Postal Service annuitants and their Medicare-eligible family members must enroll in Part B to remain in the program. So this is big. In the past, if you were on Federal Employee Health Insurance Benefits Plan, you did not need Medicare Part B to take their retirement plan into retirement. Now with this new program, it's saying that you have to, as required by the Postal Service. Now this is something they brought out a couple of years ago, right? In 2022, that was a requirement. But before that, they didn't need that. So that's important to kind of keep in mind. So a little bit of information there that's kind of interesting. So what is changing this year? Well, the prescription drug plan changes are important. Some of the other things we kind of talked about are there as well. The biggest change is what we're probably seeing is a lot of plans are pulling out of certain areas, not everywhere, it just depends on where you live and where your state is. But in some states, there's a lot of plans that are being canceled for next year because of this new prescription drug plan changes. Their benefits might be changing. A lot of plans are kind of pulling their benefits back. You're not seeing too many Medicare Advantage plans that are increasing benefits in 2025 because they're having more cost responsibility on the prescription drug side of things. So they're making up for it in their medical coverage. They're making up for it in their dental, vision, and hearing coverage. And some of them are making up for it by not providing benefits in certain areas at all. So this is where the big changes are happening. Your individual standalone prescription drug plan is going through quite a bit of changes. And these are things you need to be aware of in 2025. But there's a lot of shysters out there that will use big headlines to make it seem like something's going on other than it is. There are changes going on, but it doesn't look like it's going to be as severe as we thought it was going to be. That being said, you still should shop your plan if you're unsure about your plan in general. Our office is licensed in over 45 different states. We'd be happy to give you a no-cost, no-obligation consultation. So please give us a call, 801-255-5340. Again, 801-255-5340. And one of our team members is happy to have a conversation with you and see if maybe it makes sense for you to make a change in 2025 with all these plan changes taking place. Hope you found this video helpful. If you did, do us a favor, smash the like button for the YouTube algorithm, and comment your thoughts down below on what you think is going to be what's going to be this annual election period. Thanks so much for watching, everybody, and happy Medicaring.